In the meantime, the World Health Organization, WHO, says the new coronavirus strain is a variant of concern. The health body adds that early evidence suggested an increased risk of reinfection with this variant. The variant has an outstanding collection of mutations that are thought to increase its ability to spread and bypass some, but not all, of the protection from vaccines. Previously known as B11529, the new variant has been given the name Omicron. First reported from South Africa on November 24, a statement on Friday from the WHO said the number of cases of this variant appeared to be increasing in almost all South African provinces. Joining us tonight to discuss the new COVID-19 variant is Professor Oyewale Tamori, a virologist. Thank you very much for joining us, Prof.
My pleasure to be with you.
First was the Alpha, then we had the Beta variant, and then there was the Delta variant. Now it is confirmed that the coronavirus has a new strain with this new name. Why are we seeing all of these mutations? Is it normal, and what does it portend for global health?
It's normal. I mean, it's what you expect. Viruses normally will mutate, but a lot of times the mutation comes to nothing. But occasionally you have one or two in which comes out to be the kind of variants of concern that you are having right now. And so it is brought about by people allowing the virus to, infect some other people. And then people with different levels of immunity, the virus also tries to adapt to that and comes up with a new variant. And that's what is happening. And we are the ones who are assisting the virus to create the mutants, the variants that we are getting.
Professor, I mean, when the WHO steps in like this, people begin to worry. Now they are saying it is a variant of a concern. Could you run us through some of the WHO's perspective, why it is concerned about this?
Now, you see, when you have a variant, it could be a variant of no interest because it's not causing anything, no change, no increase in infectivity or anything. Then you have various variant of interest, when you don't still have enough information about it, but there's evidence that more people are getting infected, the number of cases are rising. And then you have the variants of concern, which by that time you reach a level where not only are people being infected, but also it's causing more severe disease. So those are the different grades. So right now, this Omicron has been tagged as variant of concern because of the transmissibility and the number of cases that we're getting in South Africa. And so Britain and others are taking precaution. They don't want anything new upon all the problems they currently have in their country.
Before we continue this conversation, let's quickly take a look at the WHO's comments on this.
WHO's Technical Advisory Group on Virus Evolution met to discuss the variant B11529, to discuss what we understand about this variant and if it should be classified as a variant of interest or a variant of concern. Based upon the information that we have, particularly from South Africa, they have advised WHO that this variant should be classified as a variant of concern. So today we are announcing B11529 as a variant of concern named Omicron. So Omicron, B11529, is named as a variant of concern because it has some concerning properties. This variant has a large number of mutations, and some of these mutations have some worrying characteristics. Right now, there are many studies that are underway. There's a lot of work that is ongoing in South Africa and in other countries to better characterize the variant itself in terms of transmissibility, in terms of severity, and any impact on our countermeasures like the use of diagnostics, therapeutics, or vaccines. So far, there's little information, but those studies are underway. So we need researchers to have the time to carry those out, and WHO will inform the public and our partners and our member states as soon as we have more information.
Okay, Prof, let's continue with that line of conversation about the concern being raised by the WHO. When they say a variant of concern, after they've done the research, what would be the next stage? What would you expect them to say, maybe after some experiments and investigations have been done?
Like the lady said, this is they continue monitoring what is happening. They are looking at the spread within the different countries. They are seeing how quickly it spreads. Not only that, they are seeing what kind of disease, what the severity of the disease. And on the basis of that, they give it just like the Delta and Omicron now. We don't know yet what the outcome will be, but we knew about Delta, and you know what Delta caused in many parts of the world. So also, they're looking at this with that same back experience, that experience of Delta, and they're being thoroughly careful to ensure that, people are prepared. And the solution to it is to ensure that we limit the transmission by wearing our masks and keeping all those non-pharmaceutical interventions.
Okay, let's talk about the fact that it seems to be coming out of South Africa. The Delta variant, we heard it was rampant in South Africa, and now we have this variant. Is it a mere coincidence, or is there a connection with the mutations, sort of, with the South African environment?
Actually, the Delta originated from India, and this one came from South Africa. So each country where the disease is spreading, the situation is that people are allowing the virus to spread from one person to another and becoming. That's the problem we have. And like I said, it's like when you talk about the mobile phone, for example. The phone is not mobile. It is people that make it mobile. So also, the transmission and the mutation we're seeing is because people are allowing the virus to spread from one person to another, and therefore causing this mutation. It's a very smart virus. It's trying to protect itself, so that when you come in and have little immunity, it adapts itself and forms something else, so that it can be able to attach and cause more infection.
Okay, let's take a quick look to get your submission in perspective. The South African Health Ministry had this to say on the mutation found there.
But we want to assure South Africans and other people elsewhere in the world that we believe that some of the reaction has actually, been unjustified. I'm referring here specifically to the reaction of countries in Europe, the UK, a number of other countries. I'm told that also a number of European Commission countries are also contemplating similar reaction. All that we did together with our scientists who make this discovery of the variant was basically to be in line with the norms and standards as prescribed by the World Health Organization, that as a world community, as we deal with this pandemic and any other world, the challenges of which any matter which challenges the world health as a whole, rather than just individual countries, we should act with transparency.
Prof, there are concerns already. European countries are placing travel restrictions on the Southern African region. You heard the minister there. Should other sister African countries be suspending flights to South Africa, maybe as a preventive measure? Or do you think they're being too hasty, considering that the WHO only says it's a variant of concern, but have not said lockdown? They are strictly advising against lockdown.
When we started with the Delta, we call it variant of concern. And people took action to prevent its spread. Those who didn't take action, it didn't spread widely in their countries. So let me put it this way. In the international situation that we have now, is every country for itself. See the vaccine, we were talking of global vaccine initiative. The Europeans started using the vaccine. They don't care about you. It's your business to take care of your own people. Charity begins at home. So South Africa is right in being concerned that this is going to affect it. So also the other country is right in deciding that, look, I want to protect my people. That's the first line of any government, protect my people. So I won't be surprised, and I won't be surprised if other African countries also look at that and say, look, we're afraid. We don't want this to get into our country. So, like I said, South Africa is protecting its interests. Those other countries are also protecting their interests.
But one would say that the speed at which the European countries are reacting is a bit more proactive compared with the African counterpart, because so far, this is days old already, but we've not heard anything from major African countries. We only are hearing from Europe. We know that Belgium has already recorded a case, and the mutation is spreading fast in South Africa. shouldn't African countries, is it enough? Let me rephrase that. Is it enough to say we should up our ante with protective measures, or we should consider a ban, in your opinion, as European countries are doing?
You know, for me, on our own African side, all we needed to do is to up our ante in terms of relation of our port of entry. We should be more careful. We should, unlike what we have in Nigeria, where we have a porous border, I would have expected the PSC to have called an emergency meeting over this issue and look at all the evidence before them and take a proper decision. And you know, the greatest problem we have for Nigeria, for example, is the fact that we have a port of entry that's as porous as anything. People will not do anything. I will not be surprised if the first case that will be reported from Nigeria will be a Nigerian who travels out of the country with a fake certificate and then gets discovered over there. We are not taking care of ourselves. The African countries are doing solidarity. Yeah, there's need for solidarity, but charity begins at home. Take care of your home first. Get your borders in proper place and ensure that, you know, nothing yet comes out. Given the system that we do in Africa, in Nigeria, for example, it's going to take us weeks before we know when a case has come in. Just like with the Delta, it took us about 3, 4, 6 weeks before we knew a case had come in. We shouldn't be that less proactive. And I have no reason to blame the European countries for being proactive over these ones. They're already having enough problems over the vaccines and things in their country. They don't want to add another extra problem at this time. Winter is coming. So if they are being proactive, that's the right thing to do. For us in Africa, I'm not saying we should do like the Europeans, but we should get ourselves together, prepared for, you know, our ports of entry should be much more less porous than it is now.
Okay, one more for the road, sir. There's concern over the efficacy of the current vaccines to, you know, stop this mutation from spreading. Can you explain to us maybe why this is so? Is it, would you say these concerns are questioning the efficacy of the vaccine already in production? Should we expect another vaccine, so to speak, or this one will be boosted to help the situation?
Let me start with just 2 explanations. The vaccines they're not made to prevent your exposure. That's your business. In fact, they're not even, once you get yourself exposed, they're not going to stop the infection. But what it does is that you don't end up with a severe disease or hospitalization. That's what vaccines are supposed to do. Vaccines are not there to prevent me being exposed. That's my business. But we also know that those who get vaccinated, yes, these vaccines may come in and cause some disease, but they're not going to cause hospitalization and death, unlike somebody who has not received vaccine. So whatever the situation, get a little bit of protection. Even if the vaccine is not going to protect against the new variant, get yourself vaccinated. That way you stand a better chance of not ending up in the hospital, of not dying because you didn't get yourself protected. So it is possible, as you said, that the new variant may overcome the protection you get from the vaccine. But at least it's not that you're going to be totally helpless.
Okay, Prof, thank you very much for joining us in NC Continental Prime.
It's my pleasure. Thank you, Fidelity.
Thank you.